Healthcare consumers, providers, creators, and advocates. Health and wellness should be everyone's top priority, and it's a dynamic topic, complex and sensitive to a vast array of factors from a local to an international scale. The healthcare industry is now at the forefront of everyday life and hopefully on the cusp of a renaissance. We're glad you've joined us for this series that explores the ideas shaping healthcare. I'm Minta Ferguson, healthcare architect and director of the Strategic Facility Planning Group, McMillan Pazdan Smith Advisors. And this is Ideas Shaping Healthcare. We're joined in the studio today by Martha Whitecotton and Meredith Letendre, and today we're going to be discussing behavioral health and its integration into primary care and telehealth. Martha Whitecotton earned her master's degree in family nursing and her Bachelor of Science degree in nursing from West Texas State University. She completed a nurse executive fellowship in 2005 at the Wharton School, University of Pennsylvania. She is a fellow of the American College of Healthcare Executives. Her experience includes serving as the president of Levine Children's Hospital and leading strategic development and programming initiatives. She is currently Senior Vice President of Atrium Health's Behavioral Health Services, with a specific focus on integrating behavioral health into primary care. This team is creating a forward-thinking, innovative, value-based care delivery model for ambulatory care, driving screening and treatment upstream, and leveraging a virtual care platform. Martha serves as the board chair of the Atrium Health Political Action Committee. She is a recipient of the 2009 Women in Business Award from the Charlotte Business Journal, a graduate of Leadership Charlotte, and a recipient of the 2018 Visionary Leadership Award from the National Council for Behavioral Health. Martha was also named to the Modern Healthcare Top 25 Innovators for 2020. With a background as a strategic and financial advisor for health systems, Meredith supports our clients by creating customized data analytics to help justify facility asset decision-making. With a background as a strategic and financial advisor for health systems, Meredith supports our clients by creating customized data analytics to justify facility asset decision-making. She analyzes market demographics, disease prevalence, and utilization trends to provide data-driven strategic direction and actionable solutions for facility master plans and community needs assessments. Bridging the gap between data and people skills, her interest in building relationships results in motivated team cultures that successfully tackle complex project challenges.
Well, thank you, Martha. We're really excited to have you here today. And today's topic is behavioral health and its integration into primary care and telehealth. So before I jump into questions, I wanted to give a little bit of context and background with this particular topic. So the COVID-19 pandemic, as we know, has already exacerbated an already severe mental health crisis in the country. So as I was researching this topic and getting ready for the podcast, I came across some interesting data from the Kaiser Family Foundation. So as of 2021, the behavioral health clinicians can only meet about a third of mental health needs across the U.S. So while this shortage is not anything surprising across many specialties, I think this specialty in particular, behavioral health, has such a huge supply and demand imbalance. So in light of this shortage and additional pressures from the pandemic, the industry has invested heavily in virtual care. I know for me personally, I've definitely partaken in telehealth during the pandemic and benefited from that. So it's, obviously making everything more accessible for those seeking mental health care, especially. So with that little bit of context and intro, I'll go ahead and jump into our first question. So as we know, Atrium Health and your team have gained national recognition for your virtual behavioral health integration program. And you guys have really made great advancements in the way mental health care is accessed and delivered today, and being really a national model. So I think it would be helpful just to start with what does that mean, and tell us more about your program and how you've gained that recognition nationally.
Okay, Meredith, let me start by laying some groundwork for how we got to this place. And when we started the behavioral health service line at Atrium Health, our mindset was around a return on investment. How do we show a change in the way the health of a population, not an individual patient, but the health of a population or a community based on the investments that we've made? And we knew that we had to get upstream, really meet people early in their illness and change that trajectory of illness. So the most logical place to do that was in primary care, because patients usually initially seek mental health care with their primary care provider, because their primary care provider is safe, there's less stigma there, so they feel comfortable approaching that primary care provider, whereas they may not feel comfortable or may feel the stigma associated with going to a psychiatrist practice. But when we looked at the 80 randomized controlled trials across the country, what we saw was an embedded model. So a therapist is embedded into a primary care practice. And what that becomes is a co-located model versus an integrated model. So there's a diagnosis made, and then the primary care provider hands the patient off to the mental health worker. And what we really wanted to do was keep the primary care provider at the center of care. So they are the prescriber, they are the owner of the patient. It's really a whole person care model. They're treating their mental health and their physical health together. Right. But because primary care providers struggle with how to manage those patients, we've created a virtual team that stands behind the primary care provider and is accessible to that provider every time they make a diagnosis or prescribe a medication or prescribe a course of treatment. We are accessible and we are there to help support them. We are also there to help support the patient outside the practice. So say the patient's had their appointment, they've been given a prescription, maybe even expressed suicidal ideation, and then the primary care provider sends, they have to go home. And so we then pick up the patient and carry them outside the practice with some assessments, some health coaching, motivational interviewing, and work with the patient in between appointments to make sure that they are engaging in treatment, taking their medication, can purchase their medication, all those things that might not ever happen without our team behind that patient and that provider.
Right. So are you guys the only that you know of health system really doing this model nationally?
Early on, we were.
Okay.
So for the first few years, and that's really probably why we gained the national reputation that we did.
Right.
What we did was really different. And the reason it was probably so different was because of the way mental health services are paid for. The way we were delivering care was not a model that was acknowledged by payers for payment. So people were hesitant to jump into that space, not understanding the importance of population health and value.
Okay.
So, but now it's become more and more popular, increasingly popular, for a couple reasons. Number one, people understand the importance of creating access to care, and they know they cannot do it with a human setting in a practice. The second is that during the public health emergency, many of the barriers to telemedicine were eliminated. And even today, Medicare is considering eliminating them for good, which is a great thing. But that helped other health systems be more courageous about jumping into this space. And we've actually begun consulting across the country, helping other health systems stand up a similar model.
Oh, that's great.
I think it's really interesting, too, because when I think about when we design primary care clinics, sometimes we design them as a care model where you have the primary care physician, then you also have a therapist in the clinic physically there, and then you also have a physical therapist in the clinic. And so you could see all three of those people in one visit. But what I like about this is you don't have to have that individual, the behavioral health professional in the clinic. It's a nice way to, I think, serve all kinds of communities and populations from a central location as opposed to having to physically have someone in every building.
Yes, and it's really attentive to another national problem, which is manpower. So psychiatrists are in very short supply, and even licensed mental health professionals, as Meredith said, are in very short supply. And so as we can optimize the work and get the right work to the right person, so much of our work in our model is done by a health coach, which is not a licensed professional, but has been trained in motivational interviewing, coaching, just the kind of coaching that you all conceptually think of, like in business coaching or, professional speaking coaching. It's a coach, and they work directly with the patient and remove barriers and help them navigate treatment and then measure their success along the way. But it's allowed us to then make the best use of the manpower that we have.
Oh, that's a great way to
Yes.
use resources. Yeah.
Yes. It makes me think of these other digital apps that are out there like Talkspace, BetterHelp. They're popping up every day almost. So do you foresee any risks with those and connecting back to the care continuum?
The only risk that I see is that if people think they are the solution,
Right.
the end-all be-all solution, none of those apps offer everything. They
Right.
offer a piece of the model of care. They offer a
Right.
therapist, or they offer motivational support through an app. They offer some coaching, but none of them offer a full
Right.
continuum.
Right.
And so, if you think that's the only answer, then there's going to be gaps in care, and people are going to fall through the cracks. Where I see the value of those apps is as adjuncts to care. It's yet another tool we can give a patient in a toolbox of tools to fight their disease. And so, it'd be like going into cancer treatment if you needed radiation and chemo and you only got chemo.
Right.
You need every tool that is available to you to battle this illness.
Right.
And so we like to think of them as additional tools, but not as the solution.
Right.
If that makes sense.
Yes. And then that brings me to my next question I had around, independent therapists. Will that more traditional avenue be able to survive in light of this push towards digital with all of these apps and models like Atrium? What does that look like from an independent therapist perspective?
I think just given the statistics that you quoted at the outset of the podcast, independent there's plenty of business to go around. And even for our patients that are in integrated care, we often refer them to individual therapy because our job is not really to be their therapist. Our job is to coach them and help them navigate care. And so I don't foresee that there will be any less demand for individual therapists. It's just that we might be able to better meet the whole demand in the space.
Yeah.
Yeah, I think it also goes back to the benefit of too, how people get the access to it. So if people are comfortable getting their care from their primary care physician, then that's an obviously route to get there. And then when I think about even my own experience, I think of when I have issues, and especially even during the pandemic, that I had to start checking, like, what are my nutrient levels? I need supplements, I need vitamins, and what kind of exercise am I getting? And doing stretching and mindfulness moments, and getting access to people and finding someone in particular I can talk to, and then having, a professional I could go to get professional help too. So I do love that integrated, because it's that whole body, that whole body kind of care.
Yeah. And it really takes every expertise and every tool we can find to help people.
Yeah. When you think of providers interacting with a patient, traditionally we've always seen them one-on-one in person, and they have a bedside manner, right? It's how they interact with the patient, how they treat them, how they talk to them, and vice versa. And with going virtual and doing so much over the phone or over the computer, how is that bedside manner changing? What is it good? Is it bad? Is it different? Can you just describe it a bit?
I think if anything, providers have had to up their game.
Okay.
It's a little bit more challenging to change the traditional model of how you've delivered care. Mm-hmm. For patients, it's been welcome. Most patients are more comfortable over the virtual care platform than they are face-to-face because, again, of stigma. People are embarrassed, a little ashamed. They feel more comfortable in their own space. I know that our providers have commented many times how refreshing it is to see the patient in the patient's own environment.
Okay.
So they can see a lot of things about their environment and not just rely on what the patient's telling them. Because obviously we all know going to the doctor, we always tell the doctor the best case scenario. Are you exercising? Oh yeah, 5 times a week. When maybe it's only 3, or maybe it's not at all.
Yeah.
So,
You're outed.
this is an extreme example, Minta, but we had a patient that one of our physicians was treating for obsessive compulsive disorder, and they were hoarding. And the psychiatrist and the therapist had been working with the patient on getting rid of things.
Okay.
And so while they were on an appointment with him, a virtual appointment, they actually packed a box with him.
Oh,
And
wow.
actually, over the course of 3 or 4 weeks, packed 3 or 4 boxes of things to leave the house, helping him part with things that would have been difficult for him to do on his own.
Yeah.
So there's this huge value to the patient being in their own environment. And if you think about the way modern medicine's been delivered, it's always been on our terms. The patient comes to us, the patient seeks us, and now it's very different, and patients really like it.
Are they making more of their appointments, keeping more of their appointments? I know that sometimes if you have to drive somewhere, try and park somewhere, especially if it's on a healthcare campus, it can be a bit cumbersome. But I would think this would make it easier for patients to make
Much
appointments.
easier. We used to have a no-show rate of about 20%. And since the pandemic and since our transition of all of our services to virtual care, not just our primary care integration, we have a no-show percentage that's below 10%.
Oh, wow.
So it's a huge decrease. So that just means more people are getting
Yeah.
access to care. It's a win all the way around.
Oh, that's awesome. And so then I think too, if so much of this is virtual, so what does it look like from a facilities perspective as the provider, having these professionals providing this care, and they're not in the clinics or all the clinics. So is it like a call center? I know COVID kind of shifted everybody's work around to work from home, or spacing out a little bit more at the office. So what does it look like from the provider side to be giving that service?
Early on in the pandemic, people were home and they were delivering everything from home. So we had to work really hard to get them the right technology so that they could. But as the pandemic has progressed, and some patients do prefer face-to-face. So most of our providers are actually in the clinic, and they do a mix of virtual and face-to-face. Sometimes they'll have a day at home and do all virtual appointments. For our technicians, our clinicians, our health coaches, our licensed professionals, they really can work from home. And it's a funny shift in our mindset because when we first started behavioral health integration, we built a call center, like a bunker where everybody had a little station, had their headset and had their work. It's this mindset of everybody has to come to a place or the work doesn't get done. And if we learned nothing else during the pandemic, we learned that the work will get done, whether the person is in their home or in the workspace. And so I think all across Charlotte, you're seeing buildings emptied out and workspaces emptied, and it's not different in this world in healthcare because it can be done on this model, and there's really a lot of work, a lot of teammate satisfaction in that control over their work day. Some people obviously miss their colleagues, so we have to work on how to make that happen.
Get the culture and the camaraderie and all of that. How do they work together? I mean, how do the coaches and clinicians bring one another into providing care? I mean, are they able to consult with one another?
Yeah, virtual care platforms are amazing in the way that they have tools for teammates to communicate.
Okay.
So, if you're on a Microsoft Teams, if you're on you're on a Epic platform and you're doing a video visit, you can go in through Microsoft Teams, which all of our teammates have, and you can do a call and ping another provider on Microsoft Teams and get them engaged in the conversation or engaged in the situation or type them a message and ask for help. And I'll just give you an example of how this worked.
Okay.
Our call center, our behavioral health call center, gets calls from all over the country. And so they actually had a call from a gentleman who had family in Charlotte. And he was actually in a mall in Iowa, and he was suicidal. He was having suicidal ideations. And through the teammate who took the call, sent a Teams message to another colleague through Teams, got the other colleague involved, got that colleague working on contacting the local police department in that city. Anyway,
fabulous.
ultimately, all this worked together that they were able to get a description of the patient, exactly where he was located, and stayed on the phone with him until the police arrived at his side and got him to safety. And so it's just so neat to think all of that was done on a virtual care platform.
and that's
Nobody was looking at each other, but we took great care of a patient. Saved a life.
Teamwork
Yes.
makes the dream
Yeah.
work example. Absolutely.
Yeah.
When I look back at COVID, and it did certainly change the way we all work and the way we think about working in the future. I had a complete shift at that time when we all went home, and I didn't realize it until probably later and working from home that I was really struggling. I was not functioning on a daily basis. I wasn't talking to people. I couldn't think. My head was really cloudy. I wasn't eating right. I had a lot of problems, and so I was finally able to see the trigger, see the issues, and was able to reach out and talk to people about it, between my husband or coworkers, just say how I feel, and then finding a professional outlet to talk about what I was going through. And I think too, even now, I'm seeing, like with my kids at school and talking on these parent-teacher conferences, that these kids have been at home, working from home virtually for, a year and a half. And when they come back, they've been pretty much alone or just with their parents. They haven't had these one-on-one interactions, and it's been emotional. And I'm hearing that even the kids are having behavioral things that are going on, and they're having to relearn interactions and kind of seek some professional assistance or what have you. But I'm curious, how has, COVID shaped the future of behavioral health? I know I certainly, it seems like that's when all the apps were starting to pop up. So what has that done?
Well, I think a couple things. With respect to children, we've seen a 30% increase in children and adolescents seeking behavioral health treatment, particularly through an emergency room, since the pandemic.
Okay.
And so there's definitely an epidemic that's going on with our children in this country that we've got to pay attention to, and the resources for children, if you can imagine, are even more minimal than they are for adults. And so we really have to pay attention to that and be mindful about it. The other thing is that we always like to try to think of one good thing that came out of a terrible thing, and one of the things that is very positive as a result of the pandemic is the willingness of people to talk about their mental health. So you're here in a podcast with a microphone talking about your own mental health, when prior to the pandemic, you may have not had the courage to do that. Yes. But it's been normalized somewhat by the pandemic. Everybody's talking about it. There's been television commercials about it. All of our physician leadership meetings, we talk about people's mental health and resiliency and how to seek resources and making sure they know what those resources are. And so I think that's an incredibly positive thing that came out of the pandemic, is people are more willing to speak their need and then more willing to seek help. And then not feel a stigma because of that. So I'm very excited about that. Now, if we can just match the resources to the demand, we'll be great.
Yeah, and it's really interesting that you mentioned that, and kind of thinking back at my own experience, like my dad had a major diagnosis. He was bipolar, and so I grew up kind of being in that environment and knowing, what was going on. And my parents were very open with me about it and communicated with me. But so perhaps I was more keen to know when I was going through something and needed, to talk to someone. But there are other people who don't have that experience and they've never been exposed to it. So I love to talk about it, because the more exposure I think people get to, the better. And so, I just really like the idea that people can comfortably talk about it and find the resources. And I think the program that you guys have pulled together is kind of doing all kinds of great in our community. So thank you. For anyone who's, interested in this resource, you can reach the Atrium Behavioral Health Call Center at 704-444-2400 or 1-800-418-2065. It's staffed 24/7 by licensed professionals. So it's just, again, another great resource that we've been talking about today that you might find could be beneficial.
Yeah, Minta, I would add, for anyone who's employed, most employers provide as an employee benefit access to an employee assistance program. And that's usually a program that the employee can access at no cost, no personal cost, to get access to help or someone to talk to about their mental health challenges. And so I would encourage people to look into that benefit from their employer and understand how to access it and freely use it. It operates completely separately from your employer. Your employer has no idea who accesses employee assistance or what they say to them. It's completely separate and very safe and private.
Today was fabulous, and thank you for your expertise and thought leadership in this area.
Well, thank you all for having me. It's great. I could talk about it all day, too.
This is the Pulse Check, where I go over a few takeaways from this episode. 1, virtual therapy has allowed providers to get a glimpse into patients' lives at home, and it's creating a more effective care plan and perhaps helping in ways that weren't provided by previous models of care for behavioral health. Another one is the benefit of the pandemic has been the improvement in access to behavioral health providers due to the suspension of regulations on telehealth during the public health emergency, and increasing comfort in addressing our behavioral health needs, and we hope it only improves. And finally, the integration of behavioral health into primary care and telehealth creates 3 big wins. 1, it minimizes wait time to see a behavioral health provider. 2, it grows competencies in primary care physicians. And 3, it's cost-effective and scalable.
Thank you for listening to Ideas Shaping Healthcare by Idea Exchange. If you have any questions on this podcast, you can find our contact information via the link in the description.
Thank you for tuning in to Ideas Shaping Healthcare, an Idea Exchange production brought to you by McMillan Pazdan Smith Architecture and Advisors.